Sometimes when it comes to medical malpractice cases, it seems like the future is now. For those of you who may be friends of Star Trek, you probably recall Dr. McCoy using his little thing to see what's going on with patients so that he can then give them some special injection and presto voila, they're cured. Well, there are times when doctors want to be able to see inside of a patient too. And to do that, they use imaging studies. Imaging studies constitute X-rays, CAT scans, MRIs, PET scans, sonograms, and the like. Malpractice cases involving these things can be as simple as the radiological miss. We call it a radiological miss because oftentimes these imaging studies, whichever kind they may be, are read by a radiologist, but they are also read by other physicians as well. An orthopedist will look at your CAT scan of your leg. A obstetrician will read your sonogram in addition to the radiologist. But whoever is looking at it, all of them are charged to see what is there to be seen. And if something is there to be seen and they fail to see it, well, that would be a radiological miss, and that would constitute medical malpractice. Sometimes the performance of the procedure itself can also cause harm. An example would be, we know that the goal of the procedure is to better see inside the patient. Some body parts are more able to be seen by an X-ray. Some are better able to be seen by an MRI. Sometimes, to enhance the ability to see blood vessels, a patient will be given a radioactive dye that will make the blood vessels appear clearer on an imaging study. Well, sometimes, unfortunately, a patient might be allergic to the dye and have a reaction to the dye and have a very problematic course as a result of that. There are certain questions and things that are supposed to be asked of the patient to minimize the risk that that be the thing that takes place. The point is, imaging studies, whatever their nature, are a fertile field to be examined to see if there's a possible case of medical malpractice. If you have a case where you believe an imaging study was misread or any kind of other problem happened, I'll digress to just mention another common problem is patients falling off the table when their films are going to be done because protections weren't being given to them, and breaking bones, hitting their head, and other kinds of terrible problems happen under these circumstances. If you have a case like that and you'd like to give us a call, we'd like to help you.